Can you get an STD without having sex? I recently saw a patient called Sarah in my clinic. She came in a little bit anxious because she didn't know what was going on. She'd never had penetrative sex, but she'd noticed she'd had some unusual vaginal discharge. She also noticed she had some burning when she was passing urine. Her first question to me was, "Doctor, I'm still a virgin. Can I have an STD even though I've never had penetrative sex?" Today in this video, I'll cover the most important things you need to know on this topic. We will cover what do we mean by sex, different ways you can catch an STI without intercourse, which infections are the most likely to spread this way, common myths versus facts. First things first, what do we mean by sex? When most people say sex, they mean penetration, whether that's vaginal or anal. But STIs can be spread through other forms of intimate contact. This can involve skin to skin, so this can be when you have close genital contact even without penetration. Oral sex, sharing toys. Which STIs can you catch without intercourse? Herpes can be spread from skin to skin contact. It's important to remember there's different types. This can involve cold sores or genital herpes. This involves different types of the HSV virus strain. It can be from kissing or even oral sex. HPV virus. This virus is linked to different conditions, for example, cervical cancer, genital warts. This again can pass from skin to skin contact, chlamydia and gonorrhea. This is much likely without anal or vaginal penetration, but can be transferred from other types of sex like oral sex. Pubic lice and scabies. So although this is not an STI, from close body contact with someone, you can spread these. Myth busting. Here's some common myths that I often hear. You can catch an STI from a toilet seat. This is false. You can catch an STI from a swimming pool. Again, this is false. Casual contact like hugging and shaking hands or sharing cutlery does not generally spread STIs. When someone has an active cold sore and then you share cutlery with them, this is one way you could transfer the HSV virus. So the truth is, STIs do not survive long outside of the body. You generally need close bodily contact to transfer an STI. But there is a real risk with unprotected sexual contact even without penetration. So for example, through rubbing and oral sex. So with my patient Sarah, who had unusual symptoms for her, I asked her some questions. So I did a history, and when I did an examination of Sarah, I noticed that she had some small lesions down in her vulval area. I took a swab of this and sent it to the lab. The swab results came back positive for the HSV virus. So even though she had not had penetrative sex, she was positive for the genital herpes virus. With Sarah, I was able to start her on treatments for genital herpes. So this involves treatments like antivirals. Here's what you can do to reduce the risk. Use condoms or dental dams if you're engaging in oral, anal, or vaginal sex. Don't share sex toys. Get the HPV vaccine if you're eligible. This reduces your chances of getting the HPV virus. Make sure you get regular STI checks. When to see a doctor. See a doctor if you've got unusual symptoms for you and you're not sure what's going on. This can involve unusual discharge, burning when passing urine, sores, blisters, or warts in the genital area, pelvic pain or bleeding after sex, and a partner who's positive for an STI. So in summary of today's video, yes, you can get an STI without penetration. This can be from skin to skin contact, sharing sex toys, or oral sex. Don't let any myths or being embarrassed stop you from getting the help that you need. I hope you found this video useful, and if you can write any questions in the comments, I'll get back to you. Thank you for watching.